Good afternoon, ladies and gentlemen, and welcome to number 6 Convent Place. This afternoon, I'm taking the information conference with the Director of Public Health, Dr. Sohail Bhatti. Together, we will review where we are in the context of the different aspects of the progress of the COVID-19 pandemic through our community. I'm, of course, going to start by giving you the most up-to-date statistics that the government has available in relation to infections and hospital admissions. I'll then set out what the next stages of the Cabinet's considerations on the lockdown will be. I'll then want to make an announcement about progress on matters related to elderly residential services. And finally, I want to go through matters relating to the Beat COVID measures, as well as highlighting some aspects of the British Airways service to Gibraltar in the month of May. Let me start now with the statistics. In the last 24 hours, there were a total of 31 attendances at accident and emergency at St. Bernard's Hospital. 5 of them had COVID symptoms. All 5 were swabbed. There were no hospital admissions overnight. This morning, there were 2 patients in the COVID ward who had tested negative and were waiting to be discharged. The latest data is as follows. The total number of swabs taken is 1,859. The results pending are 60. The results received are 1,799. Of those, a total of 132 confirmed cases of COVID have occurred in our community, of which 21 are active and recovered are 111. 111, just like the number you need to call if you have COVID symptoms. All 21 active cases are at home and all are well. So those are our latest statistics. I'm very pleased to be able to continue to talk to you about statistics. The fact is that we've not yet lost a life to COVID, although it seems inevitable that at some stage we might. When we do, we won't be talking about a statistic. We'll be talking about a member of our community, a relative, a father, a mother, a son or a daughter, a friend. And that's why it's so important that each and every one of us, each and every resident of our community, every single Gibraltarian should realize that we have to continue to follow the rules of lockdown. On Monday, the Cabinet will meet again to consider the various lockdown measures. We'll be joined by the Leader of the Opposition for the whole of that Cabinet session. The Cabinet will have to consider both the lockdown measures which affect the general population, which are due for renewal next week, and the regulations which affect our over 70s, which we've now also agreed to put on weekly review. I'll ask the Cabinet to set all of the lockdown rules together into a weekly rhythm of review, and that includes the rules relating to business closures. We must not maintain any controls on your civil liberties in place for one moment longer than is necessary. You've heard me say that a number of times before, and I'll make no apology for saying it again. We will only ease aspects of the lockdown when we are advised it is safe to do so, but we will not maintain any aspects of the lockdown longer than we are advised that we have to. It's important that you have my firm assurance in that respect. I must also tell you that the advice I'm getting suggests that we will not be easing the lockdown measures on Monday. I don't want to raise false hopes in you. We're not out of the woods yet. The statistics we're seeing suggest things are moving in the right direction, but we have not reached our destination. We're nonetheless hearing loud and clear from those over 70 about the importance of exercise for you also, and we'll be discussing that point in the Cabinet on Monday. We'll take advice on that issue as well. After that Cabinet meeting, I will ask the Leader of the Opposition to join me on Monday's information conference. In that respect, it may be useful just to remind you that we're offering these information conferences in order to ensure that you get the information that you need from us. I want you to know that you're getting all of the information that you need from your government. We're elected to serve you, and at this time we serve you best by being entirely open and transparent with you, as we always are. And you need to know that each day at a fixed time we're ready to appear before you with all the relevant information. The most relevant information that we bring you are the statistics that we provide. But we also provide you with information which is relevant to other aspects of the community's approach to the pandemic. And today, I want to tell you about the establishment of a SAGE group for Gibraltar. On Monday, I agreed with Cabinet colleagues to create a Cabinet committee to look at the various statistical analyses which are being considered and to provide us with advice thereon. I formed that committee after consultation with the Minister for Public Health and with the Director of Public Health. The group will be known as the Statistical Analysis for Gibraltar Group. The group will be led by Sergio Bossano, and it will include Ernest Mondado CBE, who was Chief Secretary for many years and who started his time in the Gibraltar government dealing with statistics. And also on the group will be Vijay Kumar MBE, who was the Director of Public Health until last year. He knows this community well, having been in post for the better part of a decade. And finally, the group has in its membership the Chief Statistician, Ms. Claire Kelly Federico, who has all the current Gibraltar statistics available for the group to access. Minister Caldes, Dr. Batty and I agree it is important to have a check on all the statistical models currently in play, and this statistical analysis group will provide that advice to the Cabinet. Also today, I want to share information on the business measures we are implementing. In that respect, I'm very proud to be able to announce that we've now published the BEAT Regulations 2020. These regulations set out the regulatory framework for the application, payment and management of the BEAT COVID-19 measures first announced by me in my emergency budget address of the 20th of March this year. I'm grateful to all members of the COVID Emergency Liaison and Advisory Committee. That includes my Cabinet colleagues, Albert Isola and Vijay Dalianani, the Leader of the Opposition, Keith Asopaldi, Opposition members Roy Clinton and Daniel Feetham, and Financial Secretary Albert Mena, as well as John Paul Farr, John Lester, the Commissioner of Income Tax, Debbie Garcia, the Director of Employment, and their teams for the work on these complex regulations. I also include in the thanks I give Unite the Union, the GGCA, the Chamber of Commerce and the GFSB, as well as the GBGA and the Finance Centre Council. I thank every one of them for their respective efforts. In our most recent discussions, we've widened the sectors which have access to our Employee Support Initiative. This will now allow security and cleaning-related businesses, courier and freight businesses, estate agents, bureau de change, and wholesalers who do not have a tobacco license to apply for BEAT COVID measures for employees that are inactive for a whole calendar month. The regulations are available on our law's website, and a more detailed statement will be issued later today on this subject. Importantly, we have now seen applications for 5,700 BEAT COVID payments. Employers have sent us about 779 emails on these measures asking us questions. All but nine have now been replied to. That is a remarkable rate of feedback for an administration of our size, and I fully and unreservedly commend our people for having done such a great job. Let us be clear. This is the much criticised public sector delivering for the private sector at a crucial time. Additionally, there's been a phone number available for people to ring if they want to ask questions about our BEAT measures. This will involve a huge injection now of public money into the economy, designed to ensure that people are able to put food on the table during this period of a public health emergency. If all of those applications for BEAT COVID payments were to be successful, the public purse will be putting £6.5 million directly into the pockets of private sector employees this month alone. Let's understand that this is a measure designed to protect employment. It's not a measure designed to protect lifestyles or fund luxuries. It is to ensure that there is food on the table of those who work in Gibraltar. Of course, if you have a mortgage, you'll be able to see your payments deferred on the basis of the measures being put in place by the banks. If you're paying rent, we've also announced measures to ensure that landlords reduce, defer, or waive those rents. And that means that you only need to finance for survival purposes this period. And this is what we've been able to deliver in record time. Whoever talks of more generous systems elsewhere has not realized that those systems are not going to produce payments for months and will not deliver the cash needed now to inactive employees. Our system produces money now because it is needed now, in particular by those who are lowest paid in our economy. Now, coming back to health-related matters, I'm happy to announce today that an isolation unit has been developed for Mount Alvernia in the area of a cottage on the grounds of that facility. The cottage will be available for use as from tomorrow. Our sincere thanks go to GJBS for their quick work on this project, and to Antonio Marin and Susan Vallejo for their work on this and all other aspects of their work at ERS. And sincere thanks also to all ERS staff, whether employed directly or through MEDOC. You've all done a great job. Thank you for your diligence in keeping COVID out of the ERS facilities. The other information I think it's important for you to have relates to the BA schedule for May. For the 4 weeks in May, British Airways will be flying to Gibraltar on Mondays, Wednesdays, Fridays and Sundays. This provides for a more even spread of flights during the week. And indeed, this is a helpful lifeline with London for people, for post, for cargo, and all other relevant permitted purposes. Finally, before I round up today, I must highlight also that our 200 41818 COVID-19 call centre has proved to be a great success, and I would like to thank the team of call handlers for handling a vast range of calls. Remember, call 111 for COVID-19 medical issues and 200 41818 for general COVID-19 issues. But if it's an emergency, please still call 190 or 199. And of course, please remember to wash your hands as often as you can. If you're not washing your hands more often than you think you should, you're not washing your hands often enough. Our hands are the most efficient vehicles for the transmission of the virus. And cough or sneeze into a disposable tissue and bin it as soon as you are able. These are the little things that will have a big effect on stopping and slowing the virus affecting our community. And remember, whatever the weather this weekend, the rules of lockdown still apply. Stay home, stay safe, and help us to slow the progress of the virus through our community. Let me hand you over now to Dr. Sohail Bhatti, the Director of Public Health.
Good afternoon, everyone. I just remember sitting here some months ago and facing this rather enormous task of trying to gather together the best of Gibraltar to try to address the challenge that I saw coming ahead. And one of the things I remember discovering was that we could not even test for the COVID virus here in Gibraltar. We had to send it off to London. I discovered that we didn't have as many swabs as we thought we might need, and in fact there wasn't as much PPE, which is the protective equipment, as we thought we might need at that time. That was really difficult to predict at that time just exactly what we were talking about. But what is really reassuring, and actually I congratulate everyone that's been working really hard at this, is that we have swabs, adequate swabs, which I'll come to in a minute. We've got significant resources invested in PPE, and not only do we have the ability to test for the COVID-19 disease here, but we've got 2 assays and we're working on 2 different assays. So that's 4 different methods of measuring and trying to identify this virus. Just keep in mind that our whole approach has been based on gathering the evidence. And again, in the early days, I remember just coming across snippets of evidence of what was happening in Wuhan. That snippet has turned from a stream into a torrent. It's actually physically very difficult to keep ahead of the information that's coming in. I'm grateful for the COVID-19 research group that was formed to help make some sense, and we've been sharing intelligence and information as it's been coming in amongst the clinical staff in the GHA. I'm also, now that we have swabs, one of the things I'm conscious of is we did do a random swab survey of the population. We sampled 400. We found 10 positive cases, and nearly all of them didn't have any symptoms, which tends to suggest that this virus at that time, and it's worthwhile remembering this test only picks up people who are ill at that time, weren't actually ill. They had no symptoms, but they were carrying the virus. We've also carried out a random survey in the ERS. Again, that's one of our most vulnerable population, and we took, I think it was about 38 samples randomly selected in that facility, and all have come back negative. So I can say again, at that time, no one seemed to have the virus. I think that's a great tribute to the management and the staff in that facility. I have plans, in fact, to extend a random survey to the frontline workers of Gibraltar. By that, I don't mean just healthcare officials. I mean also Borders and Coast Guard, the police service, the care agency, ERS. We won't do everyone. We'll take a random sample. That might well tell us, because I do know that people are anxious and worried about whether they're at risk, or in fact whether they may be putting their clients and patients at risk. This, I hope, will provide us with significant evidence to indicate what that risk is, if any. Clearly, the figures indicate that the virus in the current situation is in decline, but the question really is, what is our future? And as the Chief Minister has said, that's a really, really difficult task. One of the things that we face is that it's never really been done before, because no one ever planned for the fact that in any Western country we'd be able to do this kind of lockdown. So it's actually, there isn't a lot of evidence about what might work. So we're watching very closely what's happening in other countries and what the outcome of that is. Keep in mind that any measure that you take place is only manifest about a week to 10 days later, which is when the incubation period ends. And then actually 10 days after that, you might see a spike in people being admitted to hospital. But clearly, the factors that decide when is the appropriate time will be the number of cases we have in our community, how many beds are occupied with this illness, in fact, how many ventilators we're using. And as the Chief Minister said, at the moment, we don't have that much in the way of use. Does that mean we should release lockdown? There's an awful lot of pressure to consider those options, because like you, this damned lockdown can let you your mood go down. However, we would be looking at things like immunity in the population. We are moving to a strategy of trying to combat whenever we have little flare-ups and pockets of infection, and that might mean that actually that might give us a degree of comfort in terms of releasing that in the future. But we need to demonstrate that we can do that. Testing is obviously important. As I've said, we can swab this population. Obviously, in the longer term, one of the other things we're hoping for is vaccines and antivirals. So just remember that one of the things that will be beneficial to us in terms of trying to delay any upsurge is this buys us time, buys our entire civilization time, in fact, to identify the evidence around what might work or what might not work. Also allows us to develop vaccines. It's no small task to develop a vaccine against coronavirus, because if it was easy, the common cold has been around for as long as anyone can remember, and everyone said the way that the person that could invent the cure to the common cold would make a fortune. So if it was easy, we would have it. It's not easy, but the biggest determinant for us in terms of determining what we do is actually, to some extent, what happens outside our frontier. We're part of the Iberian Peninsula, and there's been a significant, you don't need me to tell you, it's all over the news, there's a significant challenge in the rest of Iberia, and to some extent, quite a significant element of the way that we behave and the way we have freedom to move is driven by what happens in other areas that are outside our control. So we're watching everything with a great deal of interest and a great deal of scrutiny. And I wish I had an answer for you if anyone wishes to know, but we are just ultra cautious because every single life in Gibraltar is precious to us. Thank you.
Thank you very much indeed. I'll now take questions from the media.
A question for Dr. Batty from YGTV. What is a crucial development that Public Health Gibraltar has decided will determine when you advise the government to relax or lift the lockdown? Is it when there are no new infections over the course of 1 week, for example, or some other threshold?
I think, as I was trying to address that point, there's a number of factors. And the factor is, yes, looking at the number of cases there are looking at how many are in ICU, but actually the other issues, as I've touched on, are to do with immunity and the availability of antivirals and exactly what's happening in the neighbouring areas.
A question for Dr. Batty from the Chronicle. Given the slow pace of infection, what would you say to someone who feels the lockdown has been too successful? Have you revised your expectations of a surge, or are we setting ourselves up for a peak when the lockdown is eased?
It's you're damned if you do and you're damned if you don't you? At the end of the day, one of the most successful things that we've carried out as a community is the lockdown. You know, that has to a large extent controlled what we were fearful of, what it looked like might happen if we looked at Italy or Madrid. And for that reason, I think we're in the very favourable position of not having any deaths. I think the problem about setting up for another peak, or perhaps a much bigger peak, it's obviously one of the things that is in my head in terms of consideration. I couldn't tell you whether it will come. I hope it won't come. I fear it might come. And a lot of that is driven by the way the infection spreads in Spain, particularly in neighbouring Andalusia, and what the impact of that is in terms of people crossing the frontier.
A question for Dr. Batty from GBC News. Given the shortage of PPE in the UK, in particular the shortage of gowns, how many days, weeks or months worth of PPE does the GHA currently have in Gibraltar? Have you had to adapt how PPE is deployed to ensure stocks last longer?
So as I said, in the early days, we probably didn't have as much as we would have liked. I would like to give credit to lots of people in the GHA who've gone out using entrepreneurial Gibraltarian flair to get supplies. And I'd say that actually at the moment now, we have adequate supplies to see us through a month or two, actually. But we're actually collating that information because I've asked specifically that question, which is how many days supply would we have if we used it? Rule of thumb, the models say that we would probably need it for a couple of months, maybe 3 months. It depends on whether how low that curve is that we've been trying to push down. But I think the shortage that they're suffering in the UK, we haven't got the same issues. We're still trying to procure things like hazmat suits, but that's about detail really. I think we do have adequate supplies for the moment. And in fact, I'm encouraging staff to think somewhat differently than they have if they just watch the news in England.
A question for Dr. Batty from the Olive Press. Have you been able to discover if this week's breakout at the Children's Health Centre was originated in just one person? If it was discovered purely on symptoms, why was this not identified earlier? Surely it must be of prime concern for the GHA that health workers, most who have not been in touch with a COVID patient, are such a high proportion of those infected. Why is this? Could more protective and diagnostic tools be used to ensure they do not cause further outbreaks in the most vulnerable areas, especially considering they are in a medical institution in the first place?
That's a long question. I'll try to break that up. Let me divert you a little bit in terms of responding it. The Theodore Roosevelt is an aircraft carrier. Some of you may remember that the captain lost his job, and part of the reason for that was they had this virus on board. They've actually swabbed everybody on that ship, and they found that 60% of the people that were carrying the virus had no symptoms whatsoever. Okay? The reason I raise that is that this virus, 60 to 80% of people who have the virus don't have any symptoms. The other thing is that this test that we're talking about, the swab, and it can be fairly unpleasant actually, means that this test is only valid for about 8 days during that illness, 2 days perhaps before you get your symptoms, and 6 days or 7 days after your symptoms have started. And keep in mind that the majority of people, it seems, don't have any symptoms whatsoever. That really does limit our ability to use swabs in any particular way. So the basic essence of it is that any outbreak always starts with one person having that infection, and passing it on to others. But we've got so many community-based infections, I don't think it'd be entirely fair to say it was passed by one person to another. We haven't got significant evidence of that yet. But that's what an outbreak is. It's the spread of this virus amongst people. And that's why we encourage everyone to wash their hands, keep their distance. And at the end of the day, we take a precautionary approach because these are children and children's centre, carrying out clinical activities. So we did a deep clean of that area, and it's as clean as is possible to make. I've also made the point before, this virus is not very robust and doesn't really last very long in the open environment, particularly not if it's been cleaned by dilute bleach. But we've done a deep clean. It's serviceable, it's gone back, and as a precaution, we've identified those people that we think are at most risk, and we swabbed them and we sent them home to observe. And if the swabs come back negative, clearly they haven't got the virus.
A question for Dr. Batty from the Panorama. Has Gibraltar reached a plateau in terms of the spread of the COVID-19 infection? Has the key metric for the growth of the virus been driven as low as it needs to be?
So what we have at the moment has been quite a small outbreak. So our estimation is that perhaps about 800 to about 1,000 people may have actively had this infection in our community. There's another 32,000, another 33,000 people that haven't had this virus. So I think we have had this outbreak, but it's not the major outbreak that we fear might come. Remember, this virus attacks those people who have no resistance and immunity. So if we've still got more than 30,000 of those individuals, I've used the analogy before, it's like tinder, and we're a bush standing next to a raging forest fire, and you just need a spark to come across. So being in lockdown is one of the most effective ways we have to ensure that that fire doesn't spread very rapidly. So I would say that we've been successful so far. We've managed to contain this outbreak, but in terms of where the future is, I say this again, it's driven by the environment around us, and that is, Spain is one of them, but of course we have air links with other parts of the world. Africa, we can see out of our windows, and there will be outbreaks there too.
A question for the Chief Minister from GBC News. Chief Minister, in recent weeks you have relied significantly on the advice of Public Health Gibraltar, led by Dr. Batty. You've now set up a scientific advisory group made up of professionals from different backgrounds, but with no experience per se in matters of public health. How do you envisage weighing out the advice from Public Health Gibraltar against that of the new group, especially if conflicting?
Thank you. The question is entirely misconceived. As I suggested during the course of my original intervention, the group is not a scientific advisory group, it's a statistical advisory group, and it includes two people who I think are the preeminent statisticians when it comes to understanding Gibraltar demographically, Sir Joe Bossano and Ernest Montado. It includes the current chief statistician in Gibraltar, Claire Kelly-Federico, and in fact the fourth member of the group is Dr. Vijay Kumar, who was the public health director in Gibraltar for a decade, and there's no question of therefore not continuing to take the advice of the current Director of Public Health. It's to advise us all in Cabinet, in addition to the advice we may have from the Director of Public Health, how to interpret other statistical data that is brought to the attention of the Cabinet. And as I said also during the course of my introduction, this group has been established in consultation with the Minister for Public Health and the Director of Public Health.
A question for the Chief Minister from the Olive Press. Seeing as access to Spain and UK is limited, the abortion referendum was not carried out. Couples are at home for long periods and domestic abuse has been reported to have increased. What facilities is the government making for women who would like to have an abortion or the morning after pill in the first 12 weeks of pregnancy? Or is this still considered illegal and therefore none of the government's business?
So a lot of the connections being made in that question are frankly illogical and do not follow the current status of the law. The law in Gibraltar does not change because there is a pandemic. As those who have been involved in this debate will know, the government, in consultation with the opposition, stopped the referendum that we had convened to start the law we have already passed in our parliament to allow abortion up to 12 weeks. Therefore, the position at the moment remains that abortion is not allowed under our law. This is not an issue which can change at the whim of the government or in respect of my own particular views. I've already expressed what those views are during the currency of the debate on the abortion referendum until that law is commenced or otherwise in keeping with the decision made by the people of Gibraltar in the plebiscite. When we do have the vote, nothing will change. But the morning after pill is already available in Gibraltar. That did not require the referendum.
A question for Dr. Bhatti from YGTV. Does the GHA stock remdesivir, the latest antiviral which reports suggest might be effective in helping COVID patients recover? More generally, does the GHA stock up on possible treatments just in case global stocks are depleted? Should they be approved by appropriate bodies?
So remdesivir showed some benefit when it came to SARS, and it was particularly in vitro, in other words, in a petri dish. It seemed to work, but it didn't seem to work in life. I think what I'm telling you is I've looked into that area, and we did, as part of our planning I referred to in many months ago, we did try to procure remdesivir, which is produced by Gilead, but it's not a licensed product, and we found it really difficult to be able to get that. But we have stocked up in other drugs, and we're constantly reviewing the situation in terms of the evidence. Keep in mind, however, that anecdotal reports do not constitute evidence. They are only anecdotes, and doctors are just as prone to making anecdotes as anyone else is. So we keep there's something called a preprint server, which is before publications are made. So when I talk about the evidence, we can sometimes get the evidence before it's published, and we constantly review that and share that with the doctors. And when a drug is identified as something that would be of interest, we do endeavour to try to get some stock.
The final question is from Panorama for Dr. Bhatti. In the latest briefing, the cases reported have become static or close to zero, indicating that the growth in the spread of the virus has been stopped effectively by the lockdown restrictions currently in place. What is the next step, or is anything planned?
Well, I think I tried to cover that by mentioning the future and what the elements of that would be. I continue to say that we have this forest fire across our various external boundaries, and that's going to drive a lot of what. It doesn't matter if even if we've got no COVID-19. Keep in mind at the start we didn't have any. People will keep coming to us. It's a significant element of our life is to have commerce and have relationships and even travel across the border to other areas. So inevitably we will remain at risk until the virus is defeated, whether it's through vaccines or antivirals or anything else.
A question for the Chief Minister from the Chronicle. The head of the IMF this week called on the UK to extend the Brexit deadline given the COVID-19 crisis and the demands it is placing on the governments. The UK has rebuffed that appeal, but what would you like to see the UK do in this respect? And have you made your views clear to Boris Johnson's administration? If the deadline is not extended, what impact will this have both on your contingency planning on Gibraltar's prospects in the months ahead?
So, thank you. I have made my views clear in respect to what I think should happen in relation to the negotiations ongoing for our final departure from the European Union, de facto, having already left de jure at the end of January this year. Because I've made my views clear to the administration in the United Kingdom, I'm not going to be sharing the views I've already put forward until a decision is finally made in respect of this matter. I know that things have been said about the attitude of the United Kingdom by officials, but the position does not fall to be determined until the end of June, which is the period under the treaty by which we will have to make an announcement of the final agreement between the European Union and the United Kingdom on whether or not there should be an extension of the period of negotiation of the new arrangements. I think at that time we will either have had an agreement or have made sufficient progress in respect of an agreement, or we will be expressing publicly what our views are. It wouldn't take a magician to read my mind, I imagine. Anyway, ladies and gentlemen, thank you very much indeed for joining us for this information conference. I think you've now had as much information made available to you as the government has available to it. It's important that you have all of the information that we have available to us so that you understand why we're making the decisions that we're making. But this weekend, whatever the weather, remember that the rules on lockdown still apply. Make sure that you stay home as much as you can. Go out only for the reasons provided for in the legislation. You're able to go out to take exercise and you're able to go out for an emergency or to shop. But otherwise, please stay home. And that is the job that you join us in doing, in slowing down the spread of the virus across the community. If you do not stay home, you're being irresponsible, you are not helping the government, and you are not helping the Gibraltar Health Authority to ensure it is able to cope with the cases of COVID-19 that might manifest. So thank you very much for listening. Remember to follow the rules of public health, wash your hands as often as you are able to, catch it, bin it, kill it if you sneeze or cough, and stay home this weekend. Thank you very much indeed.